Diarrhea is characterized by the frequent passage of loose or watery stools. It's a common condition that can be acute or short-term or chronic, lasting more than 4 weeks. Diarrhea can lead to dehydration and may indicate underlying health issues. Acute diarrhea lasts less than 2 weeks and is often caused by infections, food poisoning, or medications. Infectious diarrhea is caused by viruses like norovirus and rotavirus, bacteria such as Escherichia coli and Salmonella, or parasites like Giardia. Non-infectious diarrhea can result from food intolerances, allergies, or medications. Chronic diarrhea persists for more than 4 weeks and may be associated with conditions like irritable bowel syndrome, inflammatory bowel disease including Crohn's disease and ulcerative colitis, celiac disease, and malabsorption syndromes like lactose intolerance. Common symptoms of diarrhea include frequent loose or watery stools, abdominal cramps or pain, bloating, nausea, urgency to have a bowel movement, and possibly fever or chills, especially in infectious cases. Diarrhea can be caused by various factors, including infections, viral infections such as norovirus, rotavirus, and adenovirus, bacterial infections like Salmonella, Shigella, Escherichia coli, and Campylobacter, and parasitic infections such as Giardia and Entamoeba histolytica. Food-related issues can also cause diarrhea, including food poisoning from contaminated food or water, and food intolerances or allergies like lactose intolerance. Antibiotics can disrupt the balance of gut bacteria. Other medications such as antacids containing magnesium can also cause diarrhea. Inflammatory bowel diseases, or IBD, and functional gastrointestinal disorders like IBS are chronic conditions that can lead to diarrhea. Additionally, celiac disease is another chronic condition associated with diarrhea. Diagnosis typically involves discussing symptoms, their duration, and any potential triggers. A physical examination is conducted to check for signs of dehydration and abdominal tenderness. Laboratory tests, such as stool tests to identify infections or parasites, and blood tests to assess overall health and check for dehydration or underlying conditions, are commonly performed. For chronic cases, imaging studies or endoscopy may be necessary. Treatment for diarrhea focuses on managing symptoms, addressing underlying causes, and preventing dehydration. Rehydration is crucial, often involving oral rehydration solutions containing electrolytes and fluids, as well as increased fluid intake like water, clear broths, and herbal teas. Dietary changes can also help, such as following the brat diet, bananas, rice, applesauce, and toast, for mild cases, and gradually reintroducing other foods as tolerated. Medications. Loperamide, also known as Imodium, is an over-the-counter medication that can help reduce stool frequency. Bismuth subsalicylate, commonly known as Pepto-Bismol, can relieve symptoms but should be used cautiously. Antibiotics are prescribed for bacterial infections, but they are not effective for viral infections. Probiotics may help restore healthy gut flora, especially after antibiotic use. To reduce the risk of diarrhea, good hygiene practices are essential. Wash hands thoroughly with soap and water, particularly before eating and after using the bathroom. Ensure safe food handling and preparation by cooking foods thoroughly and avoiding cross-contamination. Safe drinking water is also crucial. Drink clean, safe water, especially when traveling to areas with poor sanitation. Vaccination against rotavirus can help prevent severe diarrhea in children. Complications of diarrhea can include dehydration, as the loss of fluids and electrolytes can lead to serious health issues, especially in young children and the elderly. Electrolyte imbalance can result from severe diarrhea, affecting heart and muscle function. Malnutrition is another concern, as chronic diarrhea can lead to nutrient deficiencies if not managed properly. Diarrhea is a common condition that can be caused by various factors, including infections, food intolerances, and chronic diseases. Understanding its symptoms, causes, and treatment options is essential for effective management. Maintaining good hygiene practices and staying hydrated are key to preventing diarrhea and its complications. If diarrhea persists, worsens, or is associated with severe symptoms, seeking medical attention is crucial.